Hey, let's go ahead and get started. Hello and welcome. My name is Sherry Mathis, and I am the Director of Community Education with the ALS Association. Thank you for joining us for this first installment of Empowering the ALS Journey, a webinar series. If you've attended some of our webinars in the past, you may notice that the title of our series has changed. And this is part of our effort to really put our focus on our webinar series on providing practical tools and compassionate support and empowering knowledge every step of the ALS journey. And the goal of this new series of webinars is to empower you to live fully and with purpose. So there's a few things I want to cover before we begin today. First, please know that you are muted and not on camera, so you can relax and enjoy the presentation. There will be a time at the end of the webinar that we will answer questions. So you should see that there's a chat box feature as well as a question and answer feature on your screen. You can use either of those options to enter questions you may have throughout the presentation. And just know those are only directed at myself and the panelist. So feel free to enter whatever question you have, and we'll facilitate that part after their presentation. We do have a very short survey that we ask you to complete after the webinar. It'll appear in your browser when the webinar ends. And this survey really is helpful to us. We really appreciate your feedback on your thoughts on the presentation and on any suggestions for topics you would like us to consider for future webinars. And lastly, this webinar is being recorded and will be up on the educational webinars page at als.org within a few days, along with a copy of the slide deck. So the title of today's webinar is ALS Multidisciplinary Clinics: Why It Matters, What to Expect, and How to Prepare. ALS multidisciplinary clinics are a vital part of helping individuals and their families live fully with a diagnosis of ALS. Today's webinar will highlight the importance of our multidisciplinary clinics in ALS care, why they matter, what you can expect when you go, and how to make the most out of each visit. We are delighted to be joined by two members of the ALS Association staff today that will discuss this topic with us. Lori Baker Horner, she is the Senior Director of Clinical Programs, and she has been serving the ALS community for nearly 30 years. She began her work with the ALS Association through the Wisconsin chapter, where she developed programs and services for people living with ALS throughout that state. Lori worked with a fantastic team in establishing the first certified treatment center of excellence in the state of Frodart and the Medical College of Wisconsin in 2006. In 2019, Lori joined the ALS Association's home office as a member of the clinical program team, where she works directly with multidisciplinary clinic teams throughout the country to ensure quality care for those living with ALS. And joining Lori today is Care Service Director with the ALS Association, Sara Bratten. Sara is a seasoned healthcare strategist and nonprofit leader with over a decade of experience in health administration, community outreach, and stakeholder engagement. In her current role, Sara specializes in enhancing patient outcomes through strategic care planning and interdisciplinary collaboration. Her background spans leadership roles in hospital systems and wellness programs, where she has driven measurable improvements in service efficiency and client satisfaction. So I will now hand it over to Lori and Sara to present, and I will be back afterwards to facilitate the questions and answers.
Well, thank you, Sherry. And I'm really pleased to be here and also to be able to talk about something that's really near and dear to my heart. I want to start, first of all, to talk about just what you can expect from today. Um, I'm going to start just talking about the history of the ALS Association clinical program, because I do think you're going to find that interesting. And then we're going to talk about the involvement of the clinical program to what it is today. And then what does attending a multidisciplinary clinic look like? And then we're going to move over to Sara and talk about kind of the tips, because Sara also has a background in being an ALS Association clinic liaison. So tips from an ALS Association clinic liaison, kind of looking at how to prepare, what to look at, what does attending a clinic look like? And so we're going to get a lot from today. So next slide, Sara. So going into the history of the center program, first of all, the ALS Association itself was established in 1985. So actually, a little tidbit, we're celebrating our 40th year from being established. So that's a little celebration this year. And the clinic program, or the certified center program itself, was established in 1989. So just 4 years after the ALS Association itself was established. And the ALS Association actually partnered with clinicians or leading physicians across the United States to create the center. And the idea behind it was to really design and implement and monitor a national standard of best practice of care for individuals that were diagnosed with ALS around the United States. And that was because really there wasn't a standard of care for individuals, and these clinicians really felt it was important. And then the ALS Association was the one that really sponsored this. And there were 4 clinics that were formally certified in 1989. And believe it or not, one medical director is still very active with this clinic and the ALS Association today. And again, these clinics, the 4 clinics that were formally certified, are also very active today and very, very strong. Sara, you can. There was approximately 30, I'm going to say 34 clinics up until a time of review that started in 2012 and was finalized in 2013. And this program review of the clinic program consisted of current clinic directors serving as a medical advisory, clinic nursing professionals, ALS Association staff, and ALS Association Care Services Committee members. And the goal of this was really to do a really thorough overview of the program, and because they learned a lot from the clinics and they really wanted to glean, they knew this was a strong program and they really wanted to glean the best practices from this. And from 2009, there was the American Academy of Neurology practice parameters were established, and that was also many of the clinic medical directors from these clinics were part of that establishment of those practice parameters. And so they were also involved in, so those were key to be part of, or key to be followed as part of this new, this review and following the structure. So this was a huge lift and a very important lift, because it was important that we were establishing these best practices to be followed throughout. And so the outcome was a really key, defined, consistent structure. The criteria was specifically aligned with the American Academy of Neurology practice parameters. And part of that, too, was the establishment of a recognized treatment center designation. As of this point, there was just one designation, and that was the Certified Treatment Center designation. And the difference between the Certified Treatment Center of Excellence designation and the Recognized Treatment Center was the involvement in research itself. There were many clinics that had a full and I will get into the actual criteria, but there were many clinics that had a full multidisciplinary team, but they weren't involved in research. And so there, the committee felt that that involvement, that multidisciplinary team, and that quality of care really deserved a recognition of itself. And so the Recognized Treatment Center designation was established. And the Certified Treatment Center, and the Certified Treatment Center of Excellence was set apart as they were involved in research. Now, the multidisciplinary team itself consisted, and Sarah, can you go a couple slides ahead? Because I think I'm to a couple more. Maybe move up to the multidisciplinary team. There we go. I'm moving ahead in this because I want to make sure that we focus on the multidisciplinary team. One of the key pieces of the clinics was the fact that they had a full multidisciplinary team in place. So they required, and you can see from this this graphic right here, they required a full set of this team member. They needed to have all of these team members in place, which required a vast amount of work from these clinics to have these people in place. They needed to make sure that they had all these disciplines to be able to ensure that the individual, the patient, did not have to go out and to each individual appointment, that all these people would be available to them at the one appointment. And that is not easy for these clinics to be able to put together. But it was being able to be done, and it was part of the American Academy of Neurology practice parameters, and all of these clinics were able to do it and achieve that certification. So if you can go back, Sarah, back to the so this the program review was completed, and that was in 2013. So at that point in time, we had approximately 34 centers. So let's go to 2014. What happened then? Then we had the Ice Bucket Challenge. And that was a game changer in our center program. Again, if you go to the next slide, prior to the Ice Bucket Challenge, there was approximately 34 clinics. And then if you go to the post Ice Bucket Challenge, we had a few years later, because of the funding that occurred through the Ice Bucket Challenge, it blossomed because we had the structure of the clinic through the program review. We had an extensive increase in funding that we were able to go out and move and fund some of these clinics, and it blossomed about approximately 4 years later to double the number of clinics that we had. And that all these clinics were able to extend, we were able to fund them, they were able to develop these teams, and we were able to move forward. Next slide. And to this day, this is where we're sitting. If you can see, we have approximately, we're sitting right now, and these are numbers that we're sitting at. We're able to work with, we're over 100 formally designated clinics around the United States. And these clinics, just to make sure that that these are clinics that they go through a tremendous amount when they're going through the certification process. It's a very, very robust process that they must go through. They must go through a robust application process, an on-site visit. We're going, and we're seeing some of you that are going to clinic. You may have seen me sitting with you during a site visit. You may have, and if you have, please speak up. Some of these aren't easy. This isn't an easy process to go through. And they go through an annual audit and making sure that they are meeting the criteria to ensure that they meet the criteria to maintain their designation. And we do have a process if they do not, to make sure that we can ensure that they're continuing to meet that, or if they're not, what do we do in those cases? Um, so we're continuing, we learn from these clinics also. We're learning, we're working with them. They are their own network itself. They're working on how do they decrease time to diagnosis. They're working on, these are these clinics that are doing research, how they find they're doing clinical trials. Again, the ALS Association, the Certified Treatment Centers of Excellence, they're focused on research, clinical trials, as well as bench research. They're learning a lot of what's coming out of here. And we're looking at the affiliates. These are clinics that maybe are in areas that are in rural areas, other models of clinics. So we're looking at also access to care. What can we do for rural areas, telemedicine, other models of care? Next slide, Sarah. And also veterans. We've established a partnership with the Veterans Health Administration in 2021. We reaffirmed that partnership in 2024. And the goals of the partnership is to establish multidisciplinary care with veterans. It's known that not for an unknown reason, veterans who have served in active duty are twice as likely to be diagnosed with ALS. And so they are 100% service connected, and within that, we need to establish care within the VA system. And so we have ALS multidisciplinary clinics, formally designated clinics within the VA, and they're part of that. The partnership is to establish more throughout the United States, as well as educate VA professional staff, and also collaborate in research opportunities. And I've included a link to our veterans page and on our website. And next slide. And again, I'm just going to go back to why multidisciplinary care. Again, multidisciplinary care it's evidence-based, that it improves quality of life as well as extends length of life. This is evidence-based. And as you can see from the graphic, it's patient-centric. It includes the family and caregiver. Everybody is there. Everybody is there focused on the patient and the family. And it provides you access to all the resources you can possibly have, the research opportunities, and all the different ALS organization resources that you can have. And Sarah's going to go into the ALS liaison opportunities. And I just have to say, I'm so proud to be in the position that I am with the organization, because not only am I able to help ensure that the standards of care are upheld within these clinics, but I'm able to see the amazing work that's done in these clinics, but also have the chance to meet you who are served through the clinics, and then who the team members are serving. So again, I'm going to hand it off to Sarah, and thank you. Oh, and just a reminder, please put your questions in the chat box, and we'll be answering questions at the end. Thank you.
Thank you, Lori. I appreciate it. And so, like Lori said, I want to get into really what a ALS clinic looks like, what to expect during your clinic visit, what specialist you will be seeing, and then just some strategies to get the most benefit out of those appointments that you're going to. So, first and foremost, what can you expect during your clinic visit? You know, visiting an ALS multidisciplinary clinic is a very different experience from a traditional doctor's appointment. Instead of seeing just one provider, you'll see a team of specialists, in a coordinated visit for yourself. And what the purpose of this is really to provide you that comprehensive care in one place. So that's going to reduce the burden of having to go to multiple locations or make, several appointments. You've got all of these specialists in one place for you. A visit is typically structured where each provider will come to your exam room in turn, or in some clinics, they can be a little bit different from each other. You may rotate or, through those disciplines that stay stationary. So each clinic is run differently. So I think that's something for everyone to be aware of in the way that they run, how long your clinic day could be. But the expectation and the hope is that you and your loved ones will leave the visit, really with a clear, unified care plan, that's aligned with, your goals and where you're at as far as progression is concerned. So, looking at this graphic here on this slide, before your visit, what can you expect? Hopefully, before your visit, your clinic liaison who is attending that clinic specifically, if there is one, will contact you, kind of explain the process, answer questions about your upcoming clinic appointment, and help you prepare any necessary paperwork or, materials that you might need to bring with you. Now, this could be our ALS clinic liaisons. This could be the clinic social worker. And this could even be the clinic coordinator at that specific clinic. There are some differences between your first visit and a follow-up visit to a clinic. So looking at a first visit, these clinic visits can be pretty lengthy, and we'll go into some recommendations for those clinic visits, but that first visit is typically about 3 to 4 hours. What you're going to be looking at here and what you should expect is, having baseline assessments with each specialist that you see. So, really getting a deep, in-depth history collected and developing that initial care plan for yourself or your loved one. And then follow-up visits. So you have attended your first ALS clinic. Typically, the rotation is about every 3 months. You would go to an ALS clinic. Some clinics do that differently, but that's pretty standard, is about every 3 months going to an ALS clinic appointment. So your follow-up visits are going to be a little bit shorter, 2 to 3 hours, shorter appointment focused on really tracking progression, addressing any symptoms and or, maybe new symptoms that have, arisen, and then adjusting that care plan as needed. And then lastly, and some people might not realize this, but each clinic has a meeting before and after clinic. The before is to discuss patients who are coming for the day. And then there's a team conference at the end of each clinic where after you see your specialist, the team meets and they really try to coordinate your care and develop really integrated recommendations for each individual person who they've seen at clinic that day. So who will you see? What, specialist is considered in that multidisciplinary model? As Lori showed earlier, in this graphic, it shows the different disciplines that, will typically be present at each clinic visit for yourself. First and foremost, the neurologist. The neurologist is going to manage the overall care of the person being seen. They're going to monitor the disease progression. They're going to prescribe medications and write orders for recommendations from the other ancillaries that will be there that day. Your clinic social worker. This person is integral. They're going to connect you with resources. They're going to support your emotional and or your loved one's emotional well-being throughout this process and throughout the day. You'll also see a speech therapist. And a lot of people think, well, speech therapists, they're only going to deal with speech. Why should I see them every time? Well, a speech therapist addresses so much more. They're going to address not only your communication needs, but ways to help, assist you with those needs, such as voice banking. If there's change in swallowing, just different levels of care that are provided by each person. You'll have a respiratory therapist. They're going to monitor your breathing function and help provide you breathing support options when it gets to that point in your journey. There'll be a nutritionist. They'll advise on nutrition, again, addressing swallowing issues, weight management as well. And then a physical therapist. They're going to help you maintain your mobility. And then once you do progress, they're going to recommend equipment that will help in that progression, but also help prevent complications, trips, falls, etc. And I think the biggest thing to put here is, again, every clinic runs differently. So not every clinic requires you to see every specialist each time that you attend. But just remember, you don't know what you don't know. So seeing every specialist really ensures comprehensive care and can only help you identify issues before they become a problem. So how can you and your loved ones get the most benefit from your clinic visit? First and foremost is that support piece. Having a spouse, having a caregiver, a family member, a friend, to help you really absorb the information that is, being taken in on this day, having them help you take notes and even provide an additional perspective for you. Again, these can be long days, so having somebody else be there to help you take in all of that is so important. So nothing gets missed. It helps making sure that your voice is being fully heard throughout this process. So secondly, come prepared. Again, this is a long day, so pack snacks, bring water, any needed equipment that you might feel that you might need during a lengthy amount of time. And then wear layered clothing. We all know how cold doctors' offices can be. So making sure that you're wearing layered clothing just for comfort during that full, exam process. Being, honest and open. This is a safe space for you to talk about, new symptoms such as, increased fatigue, changes in swallowing, any emotional concerns that you might have, like anxiety or depression, or even just social or logistical problems or challenges that you might be having, like maybe needing some home care, or you're seeing that transportation is becoming a little bit harder. So how can we discuss ways to help in that regard? Also, if you ever feel overwhelmed during your visit, it's okay to pause. It's okay to take some time, ask to circle back later. This is really your time, your loved one's time, to make sure that you're absorbing everything and getting what you need from this appointment. And the clinic team really wants to make sure that you're heard and supported as well. And then it's also a place too where you can, document concerns, any new symptoms that you want to bring up to them, or any challenges as well. A big part of attending clinic can also be discussing what matters to you. What you're wanting to focus on as far as quality of life is concerned. So this is really about, centering your values. What matters most to you in your daily life? What are your personal goals moving forward? Maybe it's attending your child's wedding, maintaining the ability to eat your favorite meal, or continuing to volunteer, or even continuing to work. Really sharing these goals helps your care team focus on recommendations about preserving those priorities for you and not just treating symptoms. It's also, an opportunity where we can talk about advanced care planning. Having those conversations early and openly empowers you and your loved ones to make informed decisions about your care as well. The approach of the multidisciplinary model, really is more than just clinical treatment. We want to be able to preserve your independence, your loved one's independence, and emotional well-being. So, one of the things that is discussed, very frequently in clinic are things like mobility aids, like walkers, power wheelchairs, just to maintain safety and activity. Are you struggling with communication, but that's something that's very important to you? You want to be able to preserve your voice. You want to do voice banking. Bringing up those types of things to your speech and language pathologist will be key. Um, and then any home adaptations, you think that might make your daily task easier. If you are, having trouble using a rollator in your house, maybe it's time to think about a transport chair or a power wheelchair. So all of these things we want to make sure that we're discussing, that you're discussing, you and your loved ones are discussing, so we can focus on that quality of life piece. And, we really want to support you in doing the things that bring you joy and purpose for as long as possible. A question that I feel as clinic liaisons that we get asked all of the time is, what do we do if we have an issue or something comes up in between clinic visits? And the most important thing for everyone to take from this is you do not have to wait until your next clinic appointment if something changes. Whether it's a new symptom, a concern about a recommendation, or an emergency need, you can reach out to the clinic team. Again, many clinics have a care coordinator or a liaison who can answer those questions for you or can direct you to the right person within the clinic team to get that answered for you. Whether it's new equipment, whether it's insurance support, those are things that the clinic can often quickly help facilitate for you. So keeping an open line of communication with your team helps prevent, any complications and ensures smoother care between visits. One thing that I would like to point out is, there will be emergent needs that do arise. And when those emergent needs do arise, please reach out to your local first responders in those instances. Clinic liaisons, the clinic team is there for you, but in those emergent needs, always reach out to your first responders first. And last but not least, we know that transportation can be very difficult. Traveling to a multidisciplinary clinic can be expensive with gas, sometimes lodging, time off work for your caregivers and yourself. And we have an ALS financial assistance program grant called the Hoffman Grant that can help offset, some of these financial burdens that might arise with this. It is specifically related for travel and assistance for patients who are accessing the multidisciplinary ALS clinics and is available through our ALS website. The application process is pretty straightforward. You can go to the link that is provided on this slide to access it. Your clinic social workers all should be aware of this financial grant program for travel, as well as your care coordinators who are assigned to your respective part of your state. So, are there any questions? Sherry, I'm going to toss it back over to you. I know I threw a lot of information out there pretty quickly, so I know Lori and myself are happy to answer any questions where needed.
All right. Well, thank you, Lori and Sarah, for a wonderful presentation. So we do want to open it up to some questions and answers. Questions. If you have not already put a question in the chat, feel free to do it, and we'll try to get to all of them here in the time that we have. I do see a question here from a veteran with ALS who's asking, how does he go about opening a respite facility for veterans? He's currently being seen at the VA Mather. I'm not sure if I'm getting clear what his question is, but
if I understand it right, and Joseph, I would actually, because you're seen there, I know veterans facilities very often have contracts with different places. I would actually talk to the social worker there and see, you know, I know you're talking about opening a respite facility. I definitely would talk to the social worker about what's available through that, because they definitely have contracts that they pay for, or to your PVA, just what you might be looking for. I know the PVA is amazing. So that's a paralyzed veteran, PVA Association, Paralyzed Veterans Association. You're in California, correct?
And okay, and while we're on the veterans topic, can you talk a little bit about the relationship between an ALS clinic and the VA, how they communicate with each other, and can veterans go to both the VA and a multidisciplinary clinic?
We do. I know a lot of times, many times, a veteran may start going to a public a non-VA facility or non-VA clinic, and that's how they're noted that they are a veteran, and through that clinic. And because again, you want to make sure that they're getting all the benefits they possibly can. The social worker at the clinic will want to refer them to the VA to be able to register. Um, the one thing is there are not VA multidisciplinary clinics in every place. So that's one thing you want to make sure to have multidisciplinary care. If there is a multidisciplinary clinic, then by all means, they should be attending that multidisciplinary clinic if it specializes in ALS. And there are veterans that decide that they want to stay at their clinic if there is, and that's their right, and they can still do that. Yes, yes, that does happen.
We've
I would
got
add too, Lori, that we do have quite a few clinics who have individuals who go to both still.
Yes,
They
yes,
receive
they
their
do.
care at the VA and they
Mhm.
still attend their local ALS clinic. And then there's some who solely just attend our ALS clinics that are local because they're able to get that care sooner than they would if they
Yeah,
were trying to get an appointment through the VA.
it's what works for you
Mhm.
because it's your right. Yeah.
Good.
Absolutely.
And we've got a comment here that they appreciate the Hoffman grant, that it's a great assistance since their clinic is 130
Oh,
miles from their home. So we are very grateful to the Hoffmans for providing the opportunity for us to offer that through that.
oh,
So,
and Joseph is saying too, the home-based team is amazing. I'm just amazed by what the VA can offer through the home-based teams.
mhm,
I've just, yeah, it's amazing. And what
yeah,
is this? Is
we
our
have,
first ALS clinical is tomorrow.
oh,
Oh, Mayo Clinic in Jacksonville. Okay.
well,
Well, you're
hopefully
seeing a
you've,
wonderful team at the Mayo Clinic
Yes.
in
Oh, yes.
Jacksonville.
Yeah.
yes. And hopefully you've got a little bit of information from today's that will help. And I see you also asking about potential webinars in the future for bulbar onset. That is certainly something that we should consider. If you want to throw that into the survey at the end so that we have it documented too, we will take a look at how we are addressing that. I do know we do have one coming up pretty soon that's all about voice banking, voice preservation, and all those kinds of resources that will be very helpful for you. So let's see.
I saw someone ask a question about Kaiser in the Q&A, not in the chat, I think.
Okay, let me see if I can find that here. Um, does Kaiser have a clinic?
We do have several Kaisers
Okay.
in California. Is
Uh,
that where he or she is located?
um, it doesn't say. However, they are listed all on our website. Is that correct?
Yes, yes, we should put that. Maybe we can put that in the chat. I can with that
Okay.
link.
And another question, is there a grant available that would provide for putting a car in gear to drive stair lifts or renovations to put
I'm
a
happy to
shower?
answer this, Sherry.
Can
So different states have different grant programs or services that are provided. So my recommendation would be connecting with your local care services team in your state to see if programs are available.
so yeah, and you're right, the grants can vary. So so another question that we have is, can you touch on how the multidisciplinary approach improves patient outcomes compared to a traditional model of healthcare, where they might be going different places and all?
It's the multidisciplinary care because the team, basically, because all of the disciplines are there addressing everything at once. They're interacting, they're addressing, they're specializing. They all specialize in ALS. They're understanding the interventions. They're addressing and collaborating with each other to determine the plan of care right there then, and answering those questions versus going to different providers all at once that may not even be interacting with each other. If that answers the question. I don't know if that gets to.
Well, I can add to that. So the coordinated care obviously reduces burden that's there for patients and families. But when you're attending a multidisciplinary model and you are seeing those different disciplines together, again, like I said, when I was speaking to kind of the flow of the day, those disciplines, those different providers are able to speak with each other in real time about where you or your loved one are in your progression. And so they're going to have quicker response to maybe a new need that has arisen since the last time that you were seen by, let's say, PT or OT or whoever that might be. And that there is research out there that shows that it does extend not only the quality of life of the person with ALS, but can potentially lengthen the time that their journey is. So that survival rate as well.
Right. Does the ALS clinics communicate with our PCP or other vital healthcare providers that are outside of clinic?
That's a good question. And that's something, that would be dependent on actually your connection with your PCP and making that connection initially. Because what we're trying to do is, in terms of, one of the tools that's been provided is the Think ALS tool, that a lot of what we're trying to get out to people is to educate other providers on ALS. But if your provider is in, that's the beauty of the electronic medical record in itself. If your provider is in the same, system, if you will, then they will get the information. But unless they know, it would depend if you are connecting. Actually, it's, if you're connecting
Mhm.
your PCP with, and your specialist knows, or if they know that you're seeing this provider, if you will.
It would be a simple just request on your part,
Right.
the clinical team to share your medical
Right.
records with your primary care provider.
Right. Okay, I see another question here too about how do you go about getting an in-person presentation from the ALS Association for, it's Joseph, so I don't know, for the VA or for the home care team. Anytime you're working
Oh,
with outside providers or vendors, and Sarah, you can probably speak better to this, but care services, just contact their local care services about that need. Would that be?
Yes, that would
Like
be my
any in
recommendation is
person?
reach out to your local care services. I see that you're near Sacramento, I believe.
Yeah, so that would be, yes, we know that.
Yeah. And so you would just reach out to them, and whether it's in person or again virtual, those are, there's multiple different ways that a presentation could be set up for those who would like to attend something.
And I will add that there's a lot of other resources they might know of. We have a whole professional education academy that they can also, other providers can get, the community providers can get
Oh,
information. So, yeah, just when it's not a direct medical question and you're not sure who to contact, think about your care service staff. They're there for that. Let's see.
and we have just released a really wonderful program booklet for the clinics. And we're going to be putting that out there, that it's going to, if you attend clinic, you'll be seeing it, but it's a really great booklet on all of our programs that are available nationwide. And I'll put it in the chat so you can see it. But it's really great. It's just been released this month, so you'll be seeing it if you attend clinic. And I know Sherry's going to be putting it in the recording, or
Yes,
in the release when it's available.
right.
So
Someone, Joseph, also comments that ALS Association comes to his visits, and that is true at most of our clinics. We do have some of our care service staff that are clinic liaisons that do attend your visits and meet with you while you're there, as well as do follow up afterwards. Let's see what else I'm seeing. Oh, someone's asking about when is the webinar on voice banking. I don't have that in front of me right now, but we do have you can go to our webinar page, which is at als.org/webinars. And that's where we post all the upcoming webinars, as well as you'll see other things, the way you've gotten to these before with a flyer or our social media. It is coming up. I don't know if it's later this month or if it's not until September, but it is coming up pretty soon. So, and I'm happy to send that information to you as well, Michelle. Let's see how we're doing on time. Let me ask for both you, Lori and Sarah, how do you see the ALS multidisciplinary clinic program evolving over the next 5 years or so? And if you would have one wish for our clinics, what would it be?
You want to start, Lori?
I could go off on a big old wish list, but I mean, I know that, number one, I know we want all our clinics to work together. I think, I know that they are starting, and I would like to just really have a whole, forum where everybody just really comes together. And that's starting, which I'm glad about. And we're seeing that. And one tidbit I don't think I mentioned to you is when we go on, and I'm going off track, I'm sorry, Sherry, but when we go and we are certifying these new clinics, then this is just for your information, is we go from the ALS Association, but we bring with us another center director from a certified or recognized clinic. So they come with us, and they're meeting, and they're coming, and they're meeting another directors or medical director. And so they're coming into somebody else's territory, if you will, but it's a really good connection, because then they're coming in and those relationships are forged. And it's good to see those medical directors learning from each other, and making those connections, because that's how things are going to get done. And I love watching that. And then the connections, because we need that to get somewhere. And I'm really excited about where things are going. Like, again, like, I've been in this arena for almost 30 years, and that was really, UTech was just
Mhm.
was a newbie on the market. And I'm excited about where things are at, and I'm not just throwing bubble, throwing, throwing anything out there. I truly believe we're on the cusp of something. And so um, my hope is that these clinics are going to be just to help people, because we found something that works. And that's my hope.
And I would add to that, and I think this goes directly into, the Hoffman grant that we have and everything, is just to continue to make the clinical program as robust as possible. There are still healthcare deserts out there. There are still
Yes,
states that do not have ALS specific multidisciplinary care clinics. And so how can we help support the providers in those states to get to that point, to be able to provide that care to those areas that do not have it currently, so that like we had somebody say in here, they're driving over 130 miles each
yeah,
way to go to an ALS clinic. So what do we need to do, and how can we help in building those programs? And I think that's where I know we're talking about clinical care here, but that's where advocacy comes in. That's where our
exactly.
state governments come in. Is how can we as the ALS Association partner with persons living with ALS, their caregivers, their families, to really advocate for that care in those local states and in those local areas. So that would be
Mhm.
one of the biggest, things that I would want to focus on.
Mhm.
Yeah.
Thank you. And I see, Joseph, that you would, let's see, will you reach out to us I believe that since I'm a person with ALS, you've had it for 6 years and counting. How can you help? Again, I
Yes.
direct you to your care. Well, you guys might have some answers, but otherwise, also your local care service help you get in touch with advocacy or wherever
Yeah,
you feel inclined to help with those things. Any other
yeah.
thing, Lori?
We're on the same page, Joseph. Like,
Hmm.
yeah,
Yes.
advocacy. And yeah, I think this is the way. I believe we're on track. And I think as long as we, anything, I also believe, and I love when we have these clinics, that it's like anything that you can get involved in, like, even, and I know research sometimes can get a little bit, some things can be tedious, but anything, just to learn from anything. Um, you
Yeah.
know, everything helps,
Yeah.
Right. Really focusing on what is your passion? So
Yes,
Joseph, that would be something that I would put out there. Is your passion research? Is your passion advocacy?
yes.
Is it care services? Is it, one-to-one care? Is it events, bringing awareness?
Speaking, yeah,
Right. What is your passion? Because I think if you are passionate about something, you're going to put a 100% effort in, and the sky's the limit at that point. So really finding that niche, where you want to fit in to this fight and to this journey. So.
yeah.
Well, thank you so
Well,
much,
let's keep in
Lori.
touch, Joseph.
Yes.
Yeah.
Thank you both so much for a wonderful presentation. I just want to kind of recap too that, this is really about a standard of care and getting excellent care with
Mhm.
ALS. And it's also about being sure that you're getting the health education that you need to inform the decisions that you will need to make throughout your journey. And so if you're not getting something or you have questions, just ask. I know these clinics are busy. I know that visit gets overwhelming, but they're there to help make sure you have the information that you need to live your life and make the choices you want. And I'll add to that, if you've got a hobby or something and you're finding that you're having trouble engaging in that anymore, don't just assume that you have to give it up. Bring that to your team, your occupational therapists and other people. There are so many things out there, and that I've just the technology and other instruments that can make things possible. So give them the right of first refusal. Say, I love doing this and I'm having trouble doing this, and let them help problem solve with you. So that's what they're there for. I also wanted to just wrap up as well. There's some great questions and I can see some other interest. I want to let you guys know that if you hopefully you've heard about our ALS Nexus conference, and it is actually, you can attend virtually. Yourself and your caregiver can attend virtually at no cost. And there's going to be some wonderful sessions there. Some of the questions that were coming up, there's a great session about essential partners with caregivers, and also looking at what are some of those opportunities. So yes, in adaptive sports, there's adaptive gaming, there's music, there's painting and art things that you can do. So we really want to help you live the life that you want to live as best you can. So I encourage you to look at the website for information on Nexus, and would love to have you attend in person or virtually. And a couple other reminders, of course, the recording will be up on our webinar page within a few days. And so look for it there. And like I said, we had just kind of redone things. We've retitled. So we do have a new webinar page at als.org/webinars, where you can get access to past webinars and see the next upcoming webinars. And so I encourage you to take a look at that and see what else is out there. There's some wonderful topics out there. They're broken down by categories, making it easier for you to find and watch them right there. So, and a final reminder, you will receive that short survey at the end when we close out here, and your responses really matter to us, and we appreciate you taking the time to share them with us. So again, thank you to everyone that was here today in attendance, and thank you so much again, Lori and Sarah, for such wonderful information. We appreciate it, and we hope you all have a wonderful rest of your day.